welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mealy. We're talking about a couple different procedures today. Remember, any advice we give you, consult your own physician first. All right, Dr. Mealy, let's talk about breast reductions.
Okay.
You know, when a woman needs a breast reduction, you know, the guys are like, why are you going to, reduce the boobs?
Sure.
But there's huge problems
Usually
if your boobs
symptoms.
are too large.
Yeah.
What are the symptoms?
The most common symptoms are neck pain, back pain, discomfort just in the breasts themselves.
Yeah.
Pain from the shoulder straps of the bra tends to be a big
Oh,
one.
yeah, and you can actually see the strap.
And over in the East Bay, it's hot.
Yes.
So sweating underneath can cause rashes, sometimes infections.
Very, very uncomfortable.
It's worth avoiding.
Yes, it is definitely worth avoiding. So what happens when you get a breast reduction?
So when we do a breast reduction, we just talked about breast lifts. Essentially,
Yes.
it's a lift, but we're taking out some of the breast tissue.
Oh, okay, so you just remove some of the breast tissue.
Yeah, and mostly the breast tissue, the majority of it's on the outer part of the breast, so majority of what I'm removing is the lateral, the outer part of the breast. The inner part I do remove some if we need to reduce the volume, but I try not to remove all of it because I want to leave some cleavage, some fullness, some shape in that area.
And so how much tissue can you get from a normal breast reduction?
Oh, I mean, you can do everything from nothing to remove the entire breast.
Really?
Yeah. But
Okay.
usually we want to leave a breast mound so it looks nice.
Yes, yes, yes.
But I ask my patients, and some of my patients, they're like H's and M's, and they're just huge.
Yes, just too big.
And they're tired of it. And sometimes they're like, can I just have an A cup? I'm done. Whereas other folks are like, a D is a huge reduction for me. That would be good.
Oh, geez.
But I think for most folks, removing a certain amount is necessary to get rid of all the symptoms.
And the symptoms pretty much go away. I mean, once
they go away, if it helps immediately.
Yeah, okay, that's good.
So I've done some reductions that were very long and involved because they were so big, and we're trying to get all the shape right, where it takes 5 hours to do the surgery.
Wow.
And after 5 hours of surgery, they wake up and say, my neck feels better.
Oh.
And I would think you'd be a little more sore.
Let's go to pick number one. All right, so this is breast reduction before and after.
Yeah, so this is someone whose breasts are almost to her waist.
Yes.
And it's hard to find clothes, it's hard to find bras. It's just,
it's
so out of proportion.
Yeah. Your shirts don't fit, the buttons pop off. And now you can really tell that it kind of helped her back. I mean, right away you can see how that would relieve the back.
It does, and usually we're talking about the upper back, the neck, because that's where most of the torque is from the breast.
Okay.
But sometimes the lower back is involved too, and I think it's more postural, because you can see her leaning back to support the weight.
So your whole posture is messed up.
And again, like the lift, the breasts don't swing as much, so when you're moving, it's not torquing out as much. I think that's part of the pain relief.
Number two, and let me know where the scars are too.
So number two, she's got a really, really low nipple. So in cases like this, a lot of times I can do the lift without the vertical scar, even for breast reduction. What limits me though is if there's a lot of lateral outside tissue, when we don't have that vertical scar, I can't sort of pull it together as much. So sometimes I still need that scar to sort of bring things in.
So you're actually taking the tissue and then pulling it together, sewing back.
But most breast reductions, there's a scar around the nipple, down the front, and along the bottom.
And recovery time, let's go to pick number three.
Recovery time, similar more to lifts than breast augmentation.
Oh, really?
So there are some patients that are pretty sore. I think if you have very painful menses, that first menstrual cycle tends to be more sore after reduction.
Really?
And then it gets better after that. For folks who don't have a lot of pain with the menstrual cycle, they tend to get better pretty quickly and don't have a lot of pain.
Final pick?
So same thing here, reduction down to about an A.
I was going to ask you, men, do they come in for breast reductions?
They do, but most of the reductions we're doing for men are gynecomastia, where it's just that the gland is big but the skin is tight. Okay. In this case, the skin is kind of folding over, and the nipple's already low. So if I try to just take out the tissue there, the nipple is going to be at the bottom and it's going to fall over. So what I've done is remove a sort of lens shape from the bottom of the breast in order to tighten that up and get rid of the extra skin.
Wow, okay. So I mean, I don't see any scars on him.
It's right on the bottom. You can see it just sort of right in the fold underneath the breast.
So it's pretty much disappeared. Do a lot of men come in for that?
The men I see for this are usually men who've lost a lot of weight.
Yes.
So bariatric patients who've lost 100 pounds, they have so much extra skin that their nipple's below their fold. Yeah. So sometimes we are having to use a skin graft for their nipple to bring it up. Sometimes we'll use a pedicle, but the pedicles keep some of the volume, which we don't like.
Okay. All right. We got to wrap that one up. For more information about Dr. Mealy, call 925-943-6353 or check him out on the web, drmealy.com or sanfranciscobreasts.com. We'll be right back with lots more on Body Beautiful. I don't know what's next. Wait and see.